Bismillah ar-Rahman ar-Rahim. This is Professor Abdussalam Yasin Taha from the College of Medicine, University of Sulaimani, giving a talk titled Standing on the Shoulders of the Giants. You can find this presentation in my YouTube channel using the URL at the bottom of the slide. Introduction. The history of medicine and surgery is a rich source of interesting stories of genius and brave people who paved the way ahead of mankind towards the current status of medical and surgical practice. One has to admire the enthusiasm and courage of such people to whom millions of patients ought to be grateful. In this lecture, we present few such inspiring stories. The purpose is to motivate and stimulate all people working in this field. Story number 1. In 1929, in a small hospital in Eberswald, Germany, Werner Forssmann, a young surgical resident, anesthetized his own elbow, inserted a catheter in his antecubital vein, and with a catheter dangling from his arm, proceeded to a basement X-ray room where he documented the catheter's position in his right atrium, proving that a catheter could be inserted safely into a human heart. His biographic sketch adds, Forssmann's goal was to find a safe way to inject drugs for cardiac resuscitation. He was determined that catheterization was the key, but it was believed at the time that any entry into the heart would be fatal. Forssmann was immediately fired for his self-experimentation, despite the significance of his discovery. The popular press acclaimed his work, but the medical establishment branded him as crazy, scoring him and ignoring his work for over a decade. He continued to experiment with catheterization in dogs, and it is alleged he stopped self-experimentation only when he had used all of his veins with 17 cut-downs. Discouraged by his lack of acceptance in cardiology, he switched to urology and eventually became a country doctor. He never returned to cardiology research, but was awarded a Nobel Prize in 1956, along with cardiology innovators Conant and Richards for his pioneering efforts. The second story. The history of open heart surgery is fascinating. At one time in the history, it was strongly believed that surgery on the heart was impossible. Any surgeon dares to do so was considered foolish. The dream of operating on a motionless, relaxed open heart awaited genius cardiac surgeons in the 50s of the last century to become a reality. In 1944, Alfred Blalock at Johns Hopkins University had begun successfully performing surgery on the great vessels around the heart to relieve the symptoms of tetralogy of Fallot, demonstrating that cardiac surgery could be possible. Dr. Clarence Walton Lillie, one of the world's leading cardiac surgeons, researchers, and educators, pioneered a direct, safe approach to open heart operations in the 1950s named as controlled cross circulation, for which he was known as the father of open heart surgery. Lailihi participated in 1952 at the age of 35 in the world's first successful open heart operation using hypothermia. Hypothermia, however, only gave a brief window up to 10 minutes during which surgery could be performed and was therefore not suited for complex congenital defects within the heart. This situation was changed in March 1954 when Dr. Lailihi and associates Morley Cohen, Herb Warden, and Richard Varco used controlled cross circulation to correct a ventricular septal defect in an 11-year-old boy. Well, so this is the picture of Dr. Clarence Walton Lailihi, born in 1918 and died in 1999, and who was considered the father of open heart surgery. In this picture, the concept of controlled cross circulation pioneered by Dr. Clarence Walton Lailihi in 1954 is shown. On the left side of the picture is the patient. A catheter is placed in the central venous vein, passing into the right side of the heart, draws the blood into a pump, and then the blood is pumped to the femoral vein of his father, acting as an oxygenator, and when the blood is oxygenated, it is returned to the patient by a catheter from the femoral artery of the father to the common carotid artery of the patient. The boy's anesthetized father served as the oxygenator. Blood flow was routed from the patient's caval system to the father's femoral vein and lungs, where it was oxygenated and then returned to the patient's carotid artery. The cardiac defect was repaired with a total pump time of 19 minutes. Over the following 15 months, Lailihi operated on 45 patients with otherwise irreparable complex interventricular defects. Most of these patients were less than 2 years old. Although cross circulation was a major advance, it was not adopted for widespread use because it posed a serious risk to the donor. Nevertheless, this method paved the way for the open heart surgery era. Well, who was Dr. Clarence Walton Lailihi? Clarence Walton Walt Lailihi, born in 1918 and died in 1999, was an American surgeon who pioneered open heart surgery as well as numerous techniques, equipment, and prostheses for cardiothoracic surgery. Indeed, hardly any other cardiac surgeon has introduced a greater number of innovative techniques and concepts. In mid-1950, however, his career was interrupted by a devastating health crisis. At age 31, he was diagnosed with lymphosarcoma of the parotid gland and was given a 5% to 10% chance of surviving for 5 years. The day after he completed his senior residency, he underwent head and neck surgery and mediastinal exploration by doctors Wongstein and Richard Varco. After subsequent radiation therapy, Walt Liley recovered slowly but completely, exhibiting a remarkable degree of courage and insistence. Unfortunately, his neck remained slightly disfigured for the rest of his life. Regrettably, because of deteriorating vision related to his 1950 cancer radiation treatment, he had to end his surgical career at the age of 55. Nevertheless, he remained active as a lecturer, writer, and consultant. The third story of the man on the table who devised the surgery. Lawrence K. Altman, in a cover story published in the New York Times on December 25, 2006, wrote, in late afternoon, December 31st, 2005, Dr. Michael DeBakey, then 97, was alone at home in Houston in his study preparing a lecture when a sharp pain ripped through his upper chest and between his shoulder blades, then moved into his neck. Dr. DeBakey, one of the most influential heart surgeons in history, assumed his heart would stop in a few seconds. The pain became so severe and intolerable that he assumed he had a cardiac attack. He was willing to get a cardiac arrest to get rid of the pain. But when his heart kept beating, Dr. DeBakey suspected that he was not having a heart attack. As he sat alone, he decided that an aneurysm had probably weakened the aorta and that the inner lining of the artery had torn, known as a dissecting aortic aneurysm. No one in the world was more qualified to make that diagnosis than Dr. DeBakey, because as a younger man, he devised the operation to repair such torn aortas, a condition virtually always fatal. The operation has been performed at least 10,000 times around the world and is among the most demanding for surgeons and patients. So that was the picture of Dr. Michael DeBakey, born in 1905 and died at 2008. He was the surgeon and aortic dissection sufferer. So surgeons operated in February on Dr. Michael DeBakey, repairing an aortic aneurysm using techniques that he had been pioneered. What's the problem of aortic dissection? An aneurysm or a ballooning developed in Dr. DeBakey's aorta, the main artery leading from the heart. The wall of the aorta weakened and torn, allowing blood to seep into the inside layers of the artery, a problem that can lead to sudden death. The repair was performed by using a Dacron graft 6 to 8 inches long, used to replace the damaged section of the aorta as shown in this picture. Over 70 years of his career, Dr. DeBakey has changed the way heart surgery is performed. He was one of the first to perform coronary bypass operations. He trained generations of surgeons at the Baylor College of Medicine, operated on more than 60,000 patients, including several heads of the state, and in 1996 was summoned to Moscow by Boris Yeltsin, then the president of Russia, to aid in his quintuple heart bypass operation. The New York Times reportage adds, now Dr. DeBakey is making history in a different way as a patient. He refused to be admitted to a hospital until late January. As his health deteriorated and he became unresponsive in the hospital in early February, his surgical partner of 40 years, Dr. George P. Noon, decided an operation was the only way to save his life. But the hospital's anesthesiologists refused to give Dr. DeBakey anesthesia because such an operation had never been performed at someone his age and in his condition. Also, they said Dr. DeBakey had signed a directive that forbade surgery. As the hospital's ethics committee debated in a late-night emergency meeting on the 12th floor of Methodist Hospital, Dr. DeBakey's wife, Catherine, barged in to demand that the operation begin immediately. In the end, the ethics committee approved the operation. An anesthesiology colleague of Dr. DeBakey's, who then worked at a different hospital, agreed to put him to sleep, and the 7-hour operation began shortly before midnight on February 9. It is a miracle, Dr. DeBakey said as he sat eating dinner in a Houston restaurant recently. I really should not be here. At 98, he was the oldest survivor of his own operation, proving that a healthy man of his age could endure it. Comments. The 3 stories presented in this paper and in this lecture are just few examples of giant people who served the humanity by their extraordinary thinking, insistence, and pioneering works. Werner Forsman deserves to be named the father of angiography. He has subjected himself to an invasive procedure, underwent 17 venous cut-downs, fired from his job, etc., but eventually introduced people into a field with endless diagnostic and therapeutic applications, and himself entered the medical history from its widest gates. Dr. Lailihi solved the problems resulting from oxygenators at that time and provided near natural state by his genius technique of cross-circulation. He avoided using a complex Hartling machines, yet achieved good results, 32 out of 45 survivors, in an era of high mortality due to oxygenator-related problems. Though he operated upon patients, most of them were under the age of 2 years. The story of his malignancy and his visual problem later is really exciting. Though he couldn't continue his surgical career after 55, he remained active. Dr. Walt Lailihi is one of the surgical immortals. Denton Cooley, a personal friend of Lailihi, wrote in Memoriam in Circulation 1999 issue, stating that approximately 1,000 cardiothoracic surgeons residing in numerous countries worldwide can trace their preceptorial lineage to him. Many of these surgeons, including Christian Barnard and Norman Shumway, later headed well-known cardiothoracic programs of their own. First and second generation Lailihi trainees have developed important techniques in transplantation, perfusion, coronary artery bypass, prosthetic valves, and congenital heart surgery. When it comes to Dr. Michael DeBakey, it deserves to mention that at age 23, while still in the medical school at Tulane University, DeBakey developed the roller pump, the significance of which was not realized until 20 years later when it became an essential component of the Hartling machine. His innovations in cardiovascular surgery are difficult to count. To the amazement of his colleagues and patients, DeBakey continued to practice medicine into an age well after most others have retired. DeBakey practiced medicine until the day he died and nearly reached 100 years of age in 2008. Messages: whatever we achieve in our career, we should feel humble and grateful to our predecessors and remember the letters of Ishaq Newton. If I have seen further, it is by standing on the shoulders of the giants. Standing on the shoulders of the giants. This picture is derived from Greek mythology, where the blind giant Orion carried his servant Sidelion on his shoulders. If I have seen further, it is by standing on the shoulders of the giants. This lecture is based on an article published by me entitled Standing on the Shoulders of the Giants, Stories of Three Pioneers, and published in 2014 in the International Journal of Clinical Medicine. And this is the bibliography of the paper. And in memory of Professor Siddiq Al-Khashab, born in 1937 and died at 2022, he was one of the giants and pioneers of heart surgery in Iraq. In this picture, Dr. Siddiq Al-Khashab and our beloved teacher, Professor Imad Al-Mishat, are shown. بسم الله الرحمن الرحيم ربنا لا تؤاخذنا إن نسينا أو أخطأنا. Our Lord, do not hold us accountable if we forget or err. Al-Baqarah 286. Well, with this verse from the Holy Quran, I would like to conclude my lecture. This is Professor Abdussalam Yassin Taha signing off from the College of Medicine, University of Sulaimani.